What makes a good doctor a good doctor? First of all, he has to know his topic really, really well. He has to specialize in his topic and he has to be one of the best in the field. That's the first rule, of course. Second rule, he has to be a nice person. Sometimes working with patients is not easy. You have so many patients, so many different people, so many different opinions. Everyone wants something to be done in their own way, and it's not easy. But you have to have patience to people. I've been to many doctors which are great specialists, but they do not have any patience to anyone. And that ruins all their personality. It's like you just lose all the respect of the people. So you really have to respect people, honor them, treat them as if they're like your mother, father, brother, sister, you know? This is the way you should treat people as a doctor. Also, many people mix up and they always think that if someone is a doctor, he is a good person. So actually or sometimes they also think that if he's a doctor, he is healthy. And it's so untrue, really untrue. How many doctors you see smoking, unhealthy, unhealthy weight, just being bad people, not developed ones. There's quite enough. Rudeness, of course, one of the qualities that you can see. Now, there's no excuses to this. I don't agree. You should treat everyone really nicely, even if you're tired or mistreated in your own company where you work, hospital sometimes. Sometimes it's a private company, it doesn't matter. You should treat everyone nicely. The reason why we see so many undeveloped doctors in other fields of life, they only know medicine because medicine is a very big topic. You study it for 6 years in university, then you take another year of being in hospitals, and then you take another 5 years of doing residency. So you almost miss all your 20s and even the beginning of your 30s just to only learn medicine, which is a lot. It's about 15, 12 years of studies. That's quite a big amount of time. But still, you have to develop in other ways. You have to read more books, not only about medicine. You have to explore yourself in different fields. You have to have different hobbies, not only sports. Stuff that also develop your mind, your brain. Because being a good doctor is being a good judge. You have to read the patients really well when they come to you. You have to analyze them, how they look, if they're having pain in their eyes. Like you have to see that, those small signs, because you can miss that. I know so many patients who don't feel pain that much and they say, "Ah, it's fine," but then it's really actually important to know about this pain. People don't know why they come to you. They just come to you because they feel some discomfort, but they don't know what it is. So you have to be really precise. You have to be really judgmental when people come to you. And you have to know that the whole body is connected. Everything and everywhere is connected. There's no field of medicine which is not connected. And many people also forget that. They think that they learn their own speciality, their own field, and then they forget from the rest of the body. It's not correct way to think about medicine. You should always keep in mind that diseases come from all ways, all specialities, and you have to always keep that in mind, not to lose it in your thought. But I think in any field that you work with people, you will have many interesting stories and many interesting situations. It's funny that in hospitals you have so many interesting situations, which starts from cheating wives, cheating doctors, ending in real life scenarios of death and life. It's exposing you to a lot. Make sure that you stay positive after those exposures to the world and explore. It's interesting.